Welcome to the recorded version of Mental and Behavioral Health and Aging, part of the Family Caregiver Support webinar series brought to you by the American Society on Aging and a generous sponsorship from Home Instead Senior Care. Okay, we have two presenters joining us here this morning. Lakeland Hogan is a gerontologist and caregiver advocate for Home Instead Senior Care. Lakeland works to educate professionals, families, and communities on issues older adults face. Lakeland is a doctoral candidate at the University of Nebraska-Omaha, where she is studying social gerontology. She has a Master of Arts in Social Gerontology and a Master's in Business Administration from UNO. Lakeland has professional experience in the private and public sectors of senior care services. She has worked on special projects for UNO's Department of Gerontology and the local area agency on aging. Lakeland serves as Vice President of the Board of Directors for the Dreamweaver Foundation and is active in the Alzheimer's Association's Walk to End Alzheimer's. Lakeland has a passion for helping others, especially aging adults and their families. Also joining us today is Grace Whiting. Grace is the President and Chief Executive Officer at the National Alliance for Caregiving, where she continues her tenure from previous roles, including Chief Operating Officer and the Director of Strategic Partnerships. Grace led the launch of the Caregiving in the U.S. 2015 report with AARP and directed the first national study of rare disease caregiving with Global Genes. She has contributed to several national reports on caregiving, including Cancer Caregiving in the U.S. with the National Cancer Institute and Cancer Support Community, and Dementia Caregiving in the U.S. with the Alzheimer's Association. She has spoken on caregiving at national and international conferences, including the 7th International Careers Conference in Adelaide, Australia, and at multiple national summits at the National Institutes of Health. And with that, I'd like to turn the floor over to Lakeland and Grace. Welcome.
Thank you so much, Steve. Hello, everyone, and thanks for hanging in there as we figured out the audio issue. But we are here to talk about a topic that really there has been a big spotlight shown upon in society today, and that's mental health. And we know that the mental health of older adults is important to understand because often caregivers are having to support their loved ones with mental health issues. Some people are misinformed that mental health issues such as depression or anxiety are a normal part of aging, and that is certainly not true. And so we are going to talk more about the various mental health disorders that you might find in the older adults that you work with, but most importantly, provide you with resources and tools to pass along to those family members who are supporting a loved one with mental health diagnosis. So real quick, I'm going to go over the objectives for today. I'm going to start by talking about the prevalence among older adults, then talk through some of the unique challenges for mental health caregivers. We're going to be learning from Grace about the Circle of Care resource guide for family caregivers. It's a great tool. I'm very excited for her to share with us today. And then I'm going to leave you with some additional resources, again, that you can pass along to the older adults and family caregivers that you work with. So I thought we'd start by talking about the prevalence of mental health disorders among the general population and then looking at older adults. So you can see here on this chart that the frequency of mental distress or mental health disorders actually decreases as a person, as you look across the lifespan. So we see that older adults have a lower rate of mental health disorders than the general population, except when you look at cognitive impairment and neurocognitive disorders. There are several diagnostic tools that are used out in the field to diagnose mental health disorders, the most common being the Diagnostic and Statistical Manual of Mental Disorders, which is more commonly known as the DSM-5. And we know that mental health, especially in later life, comes with several areas of complexity. We're going to be talking about some specific considerations for mental health across the lifespan. So first, I want to reiterate that mental health disorders are not a normal part of aging. When we look at the older adult population, approximately 26% of people over the age of 60 meet the criteria for mental health. And the age of onset really does vary when you look across the lifespan. And 90% of those with lifetime cases of mental disorders develop that disorder by age 42. And the rate of mental health disorders also vary by setting. For example, we see higher rates of mental disorders in nursing homes or facilities, especially that is the case with the deinstitutionalization of mental health facilities. And then when we consider mental health across the lifespan, there's really three patterns that we see. So we see those who develop a mental health disorder in early life and then maintain that into their later life. Then we see those that have grown older and experience a mental health disorder for the first time in later life. And then we see those who come to later life with a liability. That could be something like a genetic influence, a life stress, and then the aging process or the conditions of their life in their older years kind of produce or help are linked to the development of a mental health disorder. Again, mental health is not a normal part of aging, and it's really important that we educate caregivers on this so that if they're noticing changes in their loved one's mental health, that they seek medical attention in a timely manner. So when we look at a person, we want to take kind of a holistic approach. And there's this biopsychosocial model of mental health disorders that really points to a combination of three factors. There's biological factors, and these are things like genetics, medical disorders, medications, others, psychoactive substances, nutrition, hormones, physical trauma. So those biological factors are one component. Another is the psychological factors. These are learned behaviors, faulty or unhelpful ways of thinking, how a person copes, their defense mechanisms, their self-esteem, and their personality traits. And then there's also the social factors that need to be considered. These are things like culture, race, socioeconomic status, relation and influence of one's environment. So these three factors are really interrelated elements, and it's important to understand the interaction between them, especially when assessing and treating older adults for mental health disorders. So we can't just look at one aspect of a person. We really need to look holistically. So there are some additional considerations that we need to consider when looking at mental health disorders in older adults. The first is that there is often a challenge in diagnosing mental health disorders among older adults. And this is especially challenging because it can be an issue for providers to distinguish between, cognitive changes like mild cognitive impairment, Alzheimer's disease, other major neurocognitive disorders, and mental health disorders. And so it really requires interdisciplinary collaboration when someone is looking to receive a diagnosis from medical professionals. A diagnosis may also be challenging because of the stigma that we see sometimes associated with mental health disorders. An older adult might be far more comfortable raising concerns about physical symptoms than expressing emotional pain or admitting any issues or changes with their mental health. We also know that comorbidities or having multiple chronic conditions is more common among the older adult population, and it is possible to have comorbidities in mental health diagnoses. So they might have bipolar and depression or anxiety and a neurocognitive impairment. And you can also see kind of a combination of a physical illness and a mental health disorder in terms of comorbidities. So that can create some complexities in the diagnosis and the treatment. There are also common stressors of aging that may contribute to the development of a mental health disorder. And these could be things such as an older adult struggling with financial issues, conflict among their family members, recognizing a decline in their own physical health or well-being or functional abilities. And then it's also important that we do not shy away from the discussion of suicide among older adults. This is of concern. When we look across the lifespan, suicide rates are actually higher among the later half of life when compared to the general population. So older adults have an elevated suicide rate at 24% higher than the national rate. And one older adult dies by suicide in the U.S. every 1 hour and 8 minutes. So again, mental health concerns among the older adult population are of high importance, and we need to make sure that these older adults are getting the assistance and support and the treatment that they need. So I thought quickly we would go through some of the mood disorders that are found among older adults. So they break down mental health disorders into various categories. One of them is mood disorders, and that can be further broken down into major depressive disorder and bipolar disorder. And again, while depression is common among older adults, it is not a normal part of aging, and it can be very treatable. Depression can be easily confused with medical problems, cognitive impairment, variations of the grief process, and then the normal ups and downs of life. So again, that's why people might think, or family caregivers might think, that depression is just a normal part of aging. But really, again, it's not, and there's things that can be done. So we need to make sure that family caregivers are aware of the symptoms. And the symptoms can be cognitive symptoms, such as complaints about their memory. They can be somatic symptoms, such as experiencing fatigue or sleep disruption. And another symptom can be a loss of interest in activities and a loss of interest in living. And the prevalence of these depressive symptoms are actually higher among older adults than actual diagnosis. And again, this possibly points back to the fact that people think it's a normal part of aging. There might be a stigma associated with going to your healthcare provider and admitting, I'm having these depressive symptoms, I need help, I need assistance. But there are treatments. There's both medication and psychotherapy, and these can really help older adults overcome these depressive symptoms. But we do know that lifelong depression, so those who have developed depression earlier in life and have carried it through with them to older age, will have a more complicated treatment than older adults who experience depression for the first time in later life. So again, it's important to consider the person holistically, to look back in their history. Has there been a history of mental health diagnosis or challenges in the past, and could that be impacting the mental health mental health disorder that they are developing, or symptoms that are occurring today? Then when we look at bipolar, bipolar disorders are pretty rare within the older adult population. Just 0.6% have bipolar, and the most well-known is bipolar 1, which historically was called manic depression. For this diagnosis, a person experiences a full-fledged manic episode, which is impaired judgment, reckless behaviors. Those are a couple of the symptoms that someone could exhibit. And then there's bipolar 2. This includes at least one lifetime manic episode. It could be a milder version that lasts for several days. And then there's one other bipolar disorder that fits within kind of this subcategory, and that's cyclothymic disorder, which is a chronic fluctuating mood disturbance that typically lasts 2 years and involves numerous periods of symptoms. So again, bipolar is pretty rare within the older adult population, but is certainly something that you might come across in the older adults and caregivers that you work with. Then there's some other disorders. Anxiety disorders are less common in older adults than younger adults, but again, not a normal part of aging. So there are hallmarks of anxiety, cognitive symptoms such as ruminating thinking, distractibility, affective symptoms like worry, fearfulness, low mood or irritability, somatic symptoms such as racing heart, sweating, stomach distress, and other signs of physical arousal. There are various types of anxiety disorders. We have, general anxiety disorder, which is describing a broader sense of symptoms that includes excessive or unrealistic worry for on most days for 6 months or longer. We have panic disorder, which is characterized by recurrent panic attacks, specific phobias, such as an avoidance of a particular object, such as animals or heights. We also see social anxiety disorder. This is characterized by excessive fear about social situations. And then in the older adult population, sometimes we see agoraphobia, which is a distinct anxiety disorder where someone has a fear of leaving the home. Then another category of disorders is obsessive compulsive and related disorders. This includes hoarding disorder. This is one that I have seen somewhat frequently in the work that I have done among older adults. This is characterized by chronic difficulty parting with possessions regardless of their actual value. They tend to hold on to these items and experience distress when discarding items. And we see that those who have been hoarders in early life commonly carry that into later life, and the severity of the hoarding usually increases with each decade of life. We also see obsessive compulsive disorder fall under this category, recurring obsessions or compulsions, and onset is typically after age 35. So again, this could be something that an older adult developed in their earlier years and is carrying through across the lifespan. A few more disorders here on the next slide. I apologize, I'm kind of going through these quickly, but want to make sure we get to Grace and her fantastic resources. Sleep disorder. Sleep difficulties are common in older adults, more so than any other age group, occurring in about half of older adults at any given time. This can put an older adult at risk physically and mentally, leads to higher utilization of services, greater functional disability. It can reduce quality of life and even increase a person's mortality. And sleep disorders really vary based on disturbed sleep patterns and various causes of those disruptions. We also see substance-related disorders. This occurs when a person shows problematic patterns of substance use. An area of concern that falls within this is, as it relates to older adults, is prescription medication, substance abuse, and overdose, especially of opioids. And a few months ago, I did an entire webinar on opioids and older adults, so feel free to check that out. I think the recording is still out there. We also see cognitive impairment and neurological disorders. Again, this is more common among older adults, but not a normal part of aging. And this occurs when there's some degree of deterioration in cognitive functioning, and the specific diagnosis varies based on the area of the brain, the severity of onset. I could do an entire presentation just on this category alone. This involves things like Alzheimer's disease, Parkinson's, Lewy body dementia, and so forth. Chronic pain is unpleasant sensory and emotional experience that is associated with actual or potential tissue damage. This is a combination of biological and social factors that affects a person's pain level. And older adults do report some persistent pain at higher rates than other age groups. And again, this can be of concern, especially associated to prescription drug use to treat that pain and the possibility or risk of opioid abuse. We also see post-traumatic stress disorders. This is especially prevalent within those older adults who are veterans. And we also at times see sexual disorders and also personality disorders. So if family members are concerned that there's a change in their loved one's mental health status, or they're noticing changes in personality, mood, it really is important to make sure that their older adult loved one seeks an evaluation from a healthcare professional. But we do see that there is barriers to the use of mental health services and to getting a proper diagnosis. So older adults, we see pretty consistently underuse mental health services. They're less likely than the younger populations to seek out a mental health specialist, and there is an over-reliance on nursing homes for treatment or for treatment settings. So when looking at the various barriers, first is that access to mental health services, but there's also a shortage of geriatric mental health providers. I know in my local community, I can only name a handful of mental health providers that work specifically with older adults. Funding sources also can shape the availability and access of services for an older adult. And then sometimes help-seeking attitudes impact utilization. For example, an older adult might think, I would never go to psychotherapy because a person's problems are his or her own and nobody else's business. So kind of that mentality of I'm going to handle it myself, I don't want anyone else involved, could be a barrier. There's that, I've said it several times now, but the belief that depressive symptoms are a normal part of aging, that can certainly be a barrier. Knowledge and fear of psychotherapy, people might have a preconceived notion of what psychotherapy entails, and therefore they're choosing not to engage. Or maybe they don't know the benefits that psychotherapy can provide. And then there's also transportation concerns. Getting to and from a medical professional in general can be a concern, let alone a mental health provider. And actually, I was reading an article that did a survey about barriers, and I was surprised to see that stigma was actually at the bottom of the list. So stigma maybe isn't as big of a concern as it once was, and really the barriers on the screen are preventing people more frequently than stigma in getting to a mental health provider or seeking treatment. But we know that caregivers take on a lot of the care and support of an older adult with a mental health diagnosis. So it's important to keep in mind that caregivers might have specific challenges. And in just a minute, I'm going to have Grace share a really helpful tool that we can pass along to caregivers because they are dealing with these challenges that you see here on the screen. Someone who has a mental health diagnosis, they often need care and support that lasts years or decades. Oftentimes that individual is living with their caregiver or care partner, and oftentimes the care recipient is likely to be financially dependent on the person that's providing care to them. The responsibility for oversight and care coordination often falls to the caregiver, and that includes medication management. We see, among the older adult population, there's a higher number of prescription drugs that older adults take, and then you factor in a mental health disorder, they might have even more medications, and that role kind of falls, the management of those meds falls to the caregiver. And then often there's no family to assist or provide care if that caregiver, that primary caregiver, is unable to assist. So there's really a lack of support system that surrounds that family caregiver that's supporting someone living with a mental health diagnosis. And then that caregiver often takes on an advocate role. We see this across caregiving in general, but specifically to mental health caregivers. They are the advocate for the care recipient, their loved one, family member. And then mental health caregivers often exhibit a higher level of stress and burden than average caregivers, and likely due to a lot of the reasons that I just covered. So again, it's important to understand the various mental health disorders, the various challenges that family caregivers might face as they support their loved one that's dealing with this mental health diagnosis or managing it. But most importantly, it's important to point them to resources. So I will now pass it over to Grace to talk about the great resource that she's helped develop within her organization.
Thank you so much, Lakeland, and Steve, thank you and the American Society on Aging for just bringing attention to this topic. I think it's wonderful to be able to spend the afternoon with each of you and to talk a little bit about the subject. And I have to share that this is personally very important to me as I live with depression and anxiety in my day-to-day life. And so being able to help people who are caring for someone with depression and anxiety is really wonderful. You may have in your own life have had conversations with older relatives about mental illness, and Lakeland just talked about that a little bit, about the difficulties there because of some of the assumptions we make about mental illness. I can tell you in my own family, we are Southern as Southern can be, and lots of discussion about whether mental health services are better than, for example, going to church or just, bucking up and handling things on our own. So it's wonderful to be able to be more open as a society, and also to help people get the health care that they need. So back in 2016, the National Alliance for Caregiving conducted a study with NAMI, which is the National Alliance on Mental Illness, and Mental Health America. And that study talks about the challenges facing people who are caring for someone with a mental health condition or disorder. And I'm not going to go too much through there, but I'm going to give you some highlights from the research. I'll also just say, if you're not familiar with us, we've been around since about 1996, and we're a Washington think tank. We're best known for our public policy research, but we also do advocacy work on Capitol Hill. We do work in communities to help people advocate and advance policy that will support caregivers and their quality of life. And we convene a global coalition of 16 nations, each represented by an NGO in that nation. And so this mental health caregiving work has been shared not just nationally, not just with people on the Hill, but also with some of our global partners. And I think the first thing we need to remember when we talk about how does this impact the family, how does this impact caregivers in our communities, is that it's not a casserole disease. So this is just a couple of thoughts and collections from the folks that participated in that mental health study. We captured perspectives from about 1,400 caregivers. And, you know, what touched me was this: I would really like someone to bring me a casserole. They seem to be reserved for people with heart problems or cancer and accidents. And in many cases, there's some closure for those kinds of situations. But with mental illness, it never goes away. And in our case, has never gotten any better. And I think that speaks to really the isolation that a lot of people feel. In fact, the name of the report came from the second little call out here. No matter how good things are, you are always on pins and needles. You worry about relapse or not being able to get the person medication. You worry they'll stop taking their meds. You worry they'll go back to substance use. You worry about them getting angry. And looking at that, we knew that, you know, mental health caregiving had some unique stresses that were a little different than other types of caregiving. So you may know that we do a study with AARP roughly every 5 years, and we look at caregivers across the lifespan, across all different racial and ethnic backgrounds, and with oversamples for older adults. And when we look at mental health caregiving, these folks are caring about twice as long. They are providing about 32 hours a week on average. And in many cases, there's a strain of that disease, not just on the person who's living with mental illness, but on the people around them. So, for example, needing financial support from the caregiver, you know, needing someone to be able to step in and be that successor if something happens to the caregiver. And more than 6 out of 10 folks said that just the very nature of caring for someone with mental health issues had a negative effect on their own health. And that makes it very challenging, I think, for the caregiver to be that partner in care. Likewise, one of the things we saw time and time again was that older adults were actually caring for their grown children. So what you're seeing here is that about 37%, a little over a third of all the caregivers in our survey, they were actually caring for someone who was 18 to 34, and it was typically their adult child. So you can imagine sort of the issues there with transition, you know, someone moving from being a teenager to being a young adult, but still needing intervention from their parents, and then, you know, for lack of a better word, the way my dad would say it, drama, trying to help get that person where they need to be. This is just a quick breakdown. The average age of the mental health caregiver tended to be a little bit younger than what we see in our national study with AARP. These folks were typically in their mid-40s, and they were living close by or in the same household as the person who had mental illness. Likewise, we had a spread of different conditions requiring care, between about a quarter of folks reporting that bipolar disorder was the main reason for illness, sometimes called manic depression, schizophrenia, depression, anxiety, and substance use issues. And we also identified that there were system challenges. It took some families almost 12 years to get an accurate diagnosis. And even when they had a diagnosis, many people thought it might be incorrect, about 40%. There was also this sense of being excluded from mental health care conversations, feeling like someone was discharged too quickly back into the community. So essentially the hospital or other care facilities saying, we can't deal with this, so take this person back. And then some of the challenges that Lakeland spoke to around just a shortage of people who are qualified to help provide advice, whether that's a geriatric psychologist or a social worker or a therapist, in addition to insurance barriers and homelessness and self-care challenges. So we like action in addition to data. So we sat back and said, okay, well, so now we've kind of scoped out what families are going through and how can we be helpful. So we partnered with the National Alliance on Mental Illness, and with a grant from the All Communities Inspiration Grant Program, we created a guidebook for mental health caregivers. And we have 12 fact sheets in the guidebook. Each were reviewed by subject matter experts, and we had social workers, caregiver experts, and NAMI take a look at the language to make sure that it was accurate not just to the caregiver but also to the person with mental illness, and that it was respectful of what they were going through. So, for example, we have a fact sheet on communicating with health professionals, and it talks about some of the key things that make mental health caregiving unique, how federal law protects or permits communication, how communication planning can work, what are we going to discuss, how and why. How do we have a discussion about your treatment in a person-centered way? So it's not just me sitting there saying, okay, my son is bipolar and we're going to do X, Y, Z, but that the person who has a mental illness, that their voice is protected, and that the consent processes reflect the need of the folks who are engaged. It also talks about record keeping. How do we provide accurate, useful information and get access to that? And how do we promote continuity of care, which is a huge challenge in mental illness, as in many cases, the physical health care system that you might go to, your primary care doc, your oncologist, your cardiologist, those folks are not always connected in with behavioral health. And in many cases, the behavioral health folks, the training for that doesn't cross back over into primary care, acute care, long-term care. So how do we bridge those gaps? Another example is about self-care. How do we manage the stress of caregiving? And what are the ways that we can articulate the kind of stresses that we're going through? So, for example, our physical health, but also our spiritual health, our financial health, and what types of resources are available. And this resource is really intended to cover the 12 different domains. So there are facts about just mental health caregiving in general. There's discussions about legal protections, care coordination, how to navigate difficult conversations with families. And each of the fact sheets can be downloaded as a separate PDF, and it's also available at this URL here, caregiving.org/circle of care, in an HTML format, so that people who maybe have reduced vision or other challenges with their vision, that they can take a look at it or have a screen reader, speak to them and read some of the facts. So that's an overview, and I'm going to pass the baton back to my colleague Lakeland to just tell you a little bit about some resources that might be available.
Thank you so much, Grace. That resource is certainly something that I think can be so valuable to family caregivers. I like how you've broken it out into those 12 domains, and I've seen this guide. I've passed it along. I've read the facts or the sheets that coincide with each of the areas, and it truly is a valuable resource, especially if someone is new to mental health caregiving, or if they're a veteran of caregiving. There's resources that really can support them. So before we open it up to questions, I wanted to give you all a few resources in addition to the Circle of Care guidebook, which is the URL is there at the second bullet. But there's also the American Psychological Association. They have a caregiver tool called the Caregiver Briefcase. I apologize for the long URL, but you can find it on their website, apa.org. And then also if you're looking for a geriatric psychiatrist for those that you work with, you can do an online search through the American Association for Geriatric Psychiatry, their website. So you can find if you have providers in your area, or if the caregiver is long-distance caregiving, finding a more long-distance or finding a provider long-distance, that can be a helpful website. And then we do find that some extra support might be helpful in the home, and Grace talked about it, I touched on it. Oftentimes, mental health caregivers, they do not have a successor. So what if they themselves are hospitalized or, heaven forbid, passed away? Who would provide care? So finding local care and support, you can do so at Elder Care Locator on the Area Agency on Aging's website, eldercare.gov. And then finally, caregiverstrust.com has great resources for all aspects of caregiving, and so you can find that website at the bottom of the resource slide here. So I want to thank you all so much again for tuning into this webinar. We provided a lot of information. We could have gone further in depth on the various disorders, but I think at the end of the day, we wanted you all to realize that there are resources out there to support these family caregivers who are caring for a loved one with a mental health illness, and that as we as professionals, we can be the delivery agent for that type of resource, tools, and information. So with that, I will open it up for questions. So Steve, I'll hand it back to you.
Okay, super. Thank you very much, Lakeland. And Grace, for a great presentation, very important information. Everyone, it is time for the Q&A portion of this webinar. So send in those questions now if you want to, and we will get to them here, presenters. The first question here for you. Do you find that there are older adults who might have a mental health disorder, for example, bipolar disorder, that has gone undiagnosed throughout their life and becomes a suspected diagnosis when they are older? Is it worth pursuing a diagnosis?
So
go ahead, Grace. If you want to start, I can. Oh, I was going to say, I think it is possible that somebody might have gone through life without a diagnosis, but I would say if there is any sort of question as to whether or not evaluation would be beneficial, I would say so do it, most certainly, because there are treatments and resources available to those who are living with bipolar disorder. So I would say it would be of benefit. The benefits would outweigh the negatives on that one. Grace, do you have anything to add to that?
Yeah, absolutely. I mean, so at least in our study, we found that there were a lot of people who didn't have the right diagnosis, or it took several years, to get to the right diagnosis. And I think particularly when you're talking about older adults, it's important to, there's so much stigma around Alzheimer's and dementia that in many cases, sometimes people will say, oh, well, they're getting older, or this is a normal part of aging, or this is dementia, and they may actually embark on a treatment that's not appropriate for that person or actually makes the condition worse. So there's always an advantage, I think, to getting a diagnosis, even though sometimes the words bipolar, for example, can be scary. I think it's a good starting point to get the right help and the right types of therapies that would actually be useful.
Grace, I think you absolutely are right on that. And because older adults are more likely to have comorbidities, that can sometimes be a challenge in the diagnosis process. We see that, as Grace mentioned, with Alzheimer's and other types of dementia. It could be that it's someone's exhibiting symptoms of a mental health issue, but it could be that they have some sort of other medical condition that is causing issues with their cognition. Maybe it's a vitamin deficiency or a urinary tract infection, something of that sort that's causing the onset of symptoms. So it's always important, I believe, to seek medical attention if you notice any sort of change in behavior, or even if somebody has never been evaluated over their lifetime. It's never too late to seek help and assistance. But thank you for that question.
Okay. Next question. Can you talk a little bit more about the relationship between living in a nursing home and higher rates of mental illness? Does the environment itself exacerbate a mental illness or even contribute to triggering one? And if so, what can be done to mitigate this?
That was a lot of questions in one. So I recently took a course all on mental health and aging, and we talked a lot about the deinstitutionalization of mental health back kind of in the 1970s. So you no longer really see mental health facilities. You might see a wing of a hospital or an outpatient setting. They were trying to move more of those services into kind of the home setting. And so as a result, there has been an increase in the number of people living in a nursing home setting with mental health illnesses. And I would say, I don't know if I can speak, statistically to whether or not, a stay in a nursing home can increase a person's mental health, but there is more awareness in kind of the aging community that there are higher rates of mental health issues within a nursing home setting or skilled nursing facility. And so that's something that there's a growing number of mental health professionals that are working within those facilities to help provide support and resources. Grace, did you have any thoughts on this or anything to add?
Yeah, I think it's not necessarily that being in an institution causes an exasperation in the same way that, like, for example, if I abuse a substance or something. I think it's more that there's a relationship between our physical health, our emotional health, and our behavioral health. So, a person may move into a facility and experience situational depression because they're no longer in their community or the house that they grew up in, or they're no longer seeing their relatives as often, or they're not getting the same exercise or activity or socialization that they were before. So it's just something for people to be mindful of. In some cases, depending on the level of need, it might make sense for someone to be in a facility, but they also still need socialization, and they still need relationships and contacts with the people in their life. And it's easy to sort of let those things go by the wayside, once somebody has transitioned to a new setting.
Thanks, Grace. That's a great point. Kind of goes back to that biosocial psychological model that we talked about earlier. Your mental health is connected to your social well-being and your physical well-being. So you're right. You have to look holistically.
Okay. Next question. Do you have any tips for supporting seniors who are experiencing cumulative stressful events and losses and may feel that there's nothing to live for?
That's a good question. I mean,
we
do see. Yeah, go ahead, Grace. You can start this one.
Well, I was just going to say, first off, my heart goes out to them because it is really hard. And my grandmother, for example, she had several longtime friends pass away, and it's very difficult. And I think there are opportunities to get people engaged in intergenerational programs, mentoring programs. And I think coming back to that role of family, friends, and even home care providers or others, just reminding people of, a social connection and human connection is really important to your overall health.
Absolutely. I echo all of what you just said, Grace. And I think it's important, as we see older adults possibly lose loved ones or lose their abilities, to also still remind family caregivers to focus on what that older adult still is able to do and provide outlets for them to express concerns about these losses that they're experiencing. I think that if it's appropriate, even therapy can be helpful for an older adult to be able to express their concerns, their feelings around the amount of loss that they're experiencing, and again, also focus on strengths. And I love Grace's idea of intergenerational relationship and staying socially connected, because we do see that those losses, obviously losing family members and friends can be can have an impact on your isolation and potential for isolation and loneliness, but also if you're losing your functional abilities, you might not be able to get out and about as much as you used to be. So helping family caregivers realize the importance of social interaction and helping their loved ones find ways to still get out and socialize, or utilize technology, or as a family make an effort to visit more often. Those types of things can really go a long way in helping to reduce those feelings of isolation and loneliness.
Well, and if I can just add one additional thought, one of the things in mental health to be aware of is people start to give away their possessions. And now, of course, as you get older, some of this is normal because you may want to pass on, a particular piece of jewelry or something that you no longer use. But I know, and again, teasing my family, when my grandfather passed away, my grandmother gave away all kind of dishes, furniture, paintings, you name it. And now that she's sort of made peace with that loss and been through the grieving process, she wants some of her stuff back. And I think as you're looking at the people who are dealing with these things, who are grieving, particularly losses of friends, remembering to be aware that if someone's giving away all of their stuff, if they're really cutting back on activities, that can be a sign that they're in a depressive episode, and that it's helpful for them to have additional outreach and to have people say, you don't need to give all your stuff away, or you don't need to do all this just yet, or even if your mobility is limited, there's still activities we can do together.
Great point, Grace. And you made another point that, these depression or anxiety, this might be something that an older adult develops in their older years, but if they can seek treatment and find effective ways to manage their depression and anxiety, they might not it might not be something that they have to kind of live with for a long period of time. They might have to manage it, but it could be, again, very treatable. And so it's not, again, a normal part of aging and not something that they have to deal with. They can seek help and support.
All right. Presenters, are there any programs, trainings, conferences, et cetera, for professionals that you would recommend to expand their skills in treating older adults?
Well, in mental health, or more in general, because I know that there's a lot of great resources out there in general to expand your knowledge on older adults. American Society on Aging, I would say, continue to follow all that they're doing. They have great webinars, and they have an upcoming conference in spring of 2020. And then, there's various professional conferences and outlets for information. Grace, I know you worked with NAMI to help develop this tool. Do they offer education and resources to professionals as well?
They do, and I think NAMI's got an excellent network of both sort of peer-to-peer, or what they call their family-to-family program, and then they have a national conference. So they've got a lot of resources for professionals, and I would say Mental Health America also has a lot of resources. And then depending if you're working in a particular condition, sometimes the government will actually have, either through the CDC or the Department of Health and Human Services, trainings that can be helpful, particularly in this area around healthy aging and on the mental health side too. So there's a federal agency that works specifically around mental health issues and works closely with NAMI, MHA, and others. So I would check those out. And I'll also mention Mental Health America has what they call screening to supports. And it's not a diagnostic tool, but it is a screening tool to help people if they think they might have, anxiety or depression or PTSD or bipolar disorder or any of these other topics. So that can be a helpful tool as well to just begin that conversation.
Okay. The older adults of today grew up at a time when mental health problems were barely whispered about. Trying to overcome what was clearly societal stigma can be difficult. Do you have any thoughts on this?
Yes, I do. But Lakeland, I don't know if you want to go
No, Grace,
first or.
you take it away.
Yeah, I mean, I think this is an opportunity. Again, I'm going to come back to intergenerational, because I think that in many cases, um, because these these families grew up in a time when you didn't talk about it, it's almost difficult to imagine, how do I talk about this openly? And I think having someone else in the family really challenge those conceptions. So, for example, if someone says, well, we just don't do that, we just don't go to therapy, therapy is for crazy people, for example, to have somebody else in the family or to have a close friend say, well, maybe I've been to therapy or I've taken an antidepressant, and to really challenge them on, are you saying that I'm crazy, in a non-confrontational, non-argumentative type way. And I think having exposure to people who talk openly about it makes it easier and less scary. Another option, although this can be tricky at times, is to offer to go with that person, to the physician, to the psychiatrist, to the therapist, and to sit in the waiting room and to be very non-judgmental. And the last strategy I would say that I've seen people use is to talk about your mental health just like you talk about your physical health. So in the same way that I'm not going to shame you or reject you if you use insulin for your diabetes, it's okay if you need to get health care for your brain.
I think you hit the nail on the head there, Grace. I don't really think I have anything to add. I think you're right. I think talking about it and if you can share an example of maybe a friend or family member or that has had a positive experience and has had a positive benefit, sometimes that can help break down the stigma as well. And yeah, just those conversations within families. I was just thinking, Grace, as you were talking over the weekend, we were all with family around the holidays. I know this is not always the great time to bring up really touchy subjects, but one of my aunts had admitted that she had severe anxiety when she was raising her kids and working, and when she shared that, you could see people within our family just kind of that stigma and that barrier kind of dissolved, and so other people in the room were able to talk about their experience with mental health issues, and there's so much power in that. So perhaps over the upcoming holidays, you can bring up mental health as a fun family dinner conversation. Yeah.
Well, and I think I think part of it too, some families are just not going to talk about it, but that is where movies or sports or some other type of activity can be helpful, so that maybe you're watching a movie and one of the characters is going through something similar, and sometimes it's easier for people to talk about these things in the abstract than it is to have to talk directly about whatever it is they're experiencing.
Great point.
Okay. Presenters, do you have any suggestions for dealing with a situation that may not have reached a level of hoarding, but is definitely causing some fall risks in the senior's home?
That is a great area of concern. We know that accidents happen most frequently in the home, and hoarding, as you mentioned, can pose a great safety risk. So there's several things that you could do. I think making sure that the pathways that are most frequently used within the home are cleared of clutter, and trying to find ways to organize the clutter in a way that the person can still have access to the items, but helps keep the individual safe. There's a website, makinghomesafe4seniors.com, that has some great tips on how to clear the clutter and make the environment safer. I think that the thing to remember with hoarding is that removing items can cause distress. So if families can find creative ways to help relocate the items instead of taking them out of the home, that's probably an ideal situation, unless it becomes such a safety risk that further action needs to be taken. But there's some great resources out there on decluttering and that sort of thing, but it's definitely a concern. Grace, do you have any additional thoughts?
Yeah, I mean, I think your point is right. And, hoarding is really challenging. And I absolutely do think, again, you want to be careful about going in and sometimes people say, oh, we want to be helpful. We're just going to go in and, we're going to clean everything up, and isn't that great? But the problem with that is that doesn't give the person who is hoarding any time to really deal with that. So I think, talking with that person openly, and looking at the resources to navigate that, seeing if you can have another trusted person in their life, talk them through it, and then also thinking about, are there ways that you can organize the stuff or make it easier to minimize the fall risk, but not in such a way that the person will be scared that you've removed all of their belongings.
And those are some great tips, Grace. And one of those resources out there, the International OCD Foundation, they have some great tools about hoarding out there. So if you just do a Google search for the International OCD Foundation, you can learn more about hoarding and tools for helping an individual with that mental health disorder. Great question.
Okay, and can you please remind us again the name of the website that you just referenced? Was it makinghomesafe.com, or what was that?
Yep, makinghomesaferforseniors.com. There's a great
makinghomesaferforseniors.com.
Yep.
Okay. Well, Grace and Lakeland, it's just about time for us to wrap up here, but I want to thank you for joining us for the presentation today on a very important topic. Thank you so much.
Thank you. Thank you, Steve. Thanks, everyone. Grace, thank you for joining. I hope everyone has a great day.
You too. Happy holidays to everyone.